Hello, welcome to my channel. In this video we will talk about male factor infertility. Medical doctors look at male factor infertility as the main reason why couples are unable to conceive. Of all the partners wanting to conceive, who have had regular unprotected intercourse during the most fertile time frame before ovulation in each cycle, without using any type of contraception for at least a year, and are still unable to conceive, studies suggest more than 50% of the failure rate is actually due to male infertility. Approximately half of all cases of male infertility are caused by sperm disorders. It can be difficult to know whether the defect is the sole cause or only contributing to the failure to conceive, although research has shown that failure rates for both male and female infertility are less than 15%. Possible male infertility defects consist of an abnormally low number of sperms, oligospermia, or sperm that are not present, azoospermia. Male infertility may also be caused by a low sperm motility, exactly how active and fast sperm move, or a blockage of the delivery system, which does not allow sperm to exit through the ejaculate. Infectious diseases such as the mumps virus that causes inflammation are well-known causes of male factor fertility, as well as a long list of congenital disorders. In addition, these causes can also be a risk factor for male infertility. Environmental toxins, cigarette and marijuana smoke, including secondhand smoke, dangerous alcohol consumption, extreme exposure to extreme heat of the testicles that have not descended, and heavy use of smoke. Physician prescribing and street medications, trauma to the testicles, historical past of genital infections, and mumps following puberty. Diagnostic tests to ascertain the cause of male infertility will primarily involve a physical evaluation with obtaining the patient's complete medical history. Tests may consist of multiple semen analysis, collecting semen samples on 2 different days, to check various items such as ejaculate volume, total sperm count, sperm motility, sperm morphology, size, shape, and normal condition, acid and alkalinity, pH. Balance, and several additional tests to rule out any type of variables that may cause or contribute to the level of infertility, such as diseases of the male reproductive organs or any problems with sperm. It can be difficult or impossible to recover many of the risk factors that lead to male infertility, yet many of them can be fixed and reversed. Occasionally, by simply reversing lifestyle choices, improving eating habits, reducing stress, and protecting yourself from dangerous toxins, along with using male fertility health supplements, and possibly using medications prescribed by your doctor, you can increase your fertility level, enhance general reproductive health, and bring in active, healthy sperm for your newborn. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about male factor infertility, please visit my own site. You will find the website link in the description. Thank you.